Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I wanted to tell you about what I'm doing next month in September in Amsterdam. We are being hosted by Xavier Fricker's organization, which is called Kung Fu Seminars. kungfu.eu is their website, so you can read more about it. But we're doing the first European Sports and Orthopedic Acupuncture Conference. We have been trying, I've been teaching in Europe for several years, trying to bring more orthopedic styles of acupuncture to Europe, where the training has, until maybe 6 or 7 years ago, was really focused on traditional Chinese acupuncture alone. So, and the closest you would get to some neurological approach would be something like a scalp acupuncture. So this is, straight out of Canada acupuncture, the big acupuncture pain management doctor geniuses like Joseph Wong and Si Chan Gun, and then the people who developed more from them, like Alejandro Ilioinguinal, Clarico. He's the department head in, I hope I got his title right, for the medical acupuncture program at McMaster. So a lot of this has been very North America based. So I teach in Europe and in Australia with the hopes of bringing this very effective style of acupuncture to more people so they can help other people. And I would say the biggest difference from what I teach and how I teach is that it is not a translation into traditional Chinese acupuncture. I approach everything from a neuroanatomical approach. I talk about the muscles and the nerves, and very rarely will you hear me talk about Chinese meridians, Chinese pain, Chinese diagnosis patterns, or acupuncture points. I like to be straightforward and not get people confused with the overlap. So what in September, I will be teaching a lot of things that I have not taught yet. I am teaching something that I have been teaching recently, which is the treatment of migraines, primarily looking at entrapment of occipital nerves. But the second half of the day is going to be all hip related, hip, pelvis, pelvic pain, pelvic symptoms. So I will be covering things like ilioinguinal nerve entrapment that can cause pain into the genitals. I will be covering lateral femoral cutaneous nerve entrapment, or Meralgia, Paresthetica, burning pain on the lateral thigh caused by an entrapment in the hip. I will be covering superior cluneal nerve entrapment, which can look like low back pain or even sometimes like a pseudo-sciatica. I will be covering obturator nerve entrapment at the obturator tunnel, or obturator tunnel syndrome. I will be covering what else? Um, Something else. The sorry, I'm completely forgetting something. There's another. Well, I'm definitely covering sciatica. I mean, sciatica number one, and all the double crush, triple crush, quadruple crush syndromes caused by sciatica. And there's one other that I'm completely forgetting right now. I think Obturator. I got the lateral. Okay, well, it'll come to me. So lots of nerve entrapments and how to treat them and how to recognize them. Oh, we're going to do superior gluteal nerve entrapment, the neuralgia involved, not just the weakness, but pain that can look like pseudo-sciatica. So it'll be very interesting because these are not, nerve entrapments are not going to be found for the most part by muscle tests. This is recognizing patterns, knowing the entrapment zone that you need to be palpating, and know how to palpate it, and know what you're looking for, the pathway of the nerve and where it's going to get entrapped. So this is not orthopedic assessment like many people have learned with manual muscle testing. You have to actually understand the pathway of the nerve, where it's going to get entrapped, and how to feel for those entrapments. And that's what I'm going to be covering. So it's new material. And like I said, it's not a translation into a traditional concept. We are not going to be talking about treating the gallbladder meridian because it's neuropathies. We will be looking at the nerves, the nerve pathway, the muscles, and palpating and treating for effective relief for entrapped nerves. So that will be in September. If you're interested, I'll put the link in the summary for this episode, so you can check it out. You can see what we're doing, and I will be joined by Dr. Jenny Nieders, who is the team acupuncturist for the San Francisco 49ers. And I will be joined by Dr. Josh Margolis, who has been working in orthopedic acupuncture for a couple decades. And he will be bringing some very interesting work on central sensitization. And I believe he's doing something with brachial plexus. And Jenny's doing core stabilization in sports, pelvic stabilization. So very interesting material from people that have not taught, that I believe have not taught in Europe, that Europe should be aware of. So I think it's going to be excellent. I hope people can make it. It is in late September. I believe it's 21 through 23. I might be wrong. Hopefully I'm right. So anyway, I hope you will check that out. These nerve entrapments are frequently misdiagnosed or not even recognized. And I have to admit, having learned more about them and their symptoms, I can look back on old cases and know that I missed certain things, certain nerve entrapments that I misdiagnosed as something else. And even if I was successful, it's important even if I was successful in relieving their pain or getting them out of that problem, it's important to know for future patients what I was actually dealing with, so that I can get fast results, get the best result on the first visit. So that's all I'm going to talk about for today's episode. And check out the info. I'll put the link in the summary. If you are an acupuncturist and you have time to come to Amsterdam in September, we would love to have you there. And I think you will find it very, very interesting. All right. Thank you. Take care.